Torsional deformity of the lower limb can be an underlying cause for patellofemoral instability and should be assessed if there are clinical signs of maltorsion. As the analysis of rotational or torsional deformity can pose a difficult endeavor if not performed on a regular basis, we would like to show you a simple way to analyze it on CT or MRI using standard PACS tools. So in this case we're using a CT scan from a lady with patellofemoral instability and clinical signs of excessive femoral anteversion. We start by identifying the center of the femoral head by drawing a circle of best fit. From the center of the femoral head, we then measure the angle between the femoral neck axis and an interconnecting line between the two ischial tuberosities, which is 25 degrees in this case. Alternatively, you can just draw the second line parallel to the lower border of your screen. So 25 degrees of femoral anteversion at the hip joint. Then we scroll down to the knee joint where we draw a tangent line between the two most posterior aspects of the femoral condyles. From here we measure the angle again to a reference line which is parallel to the lower border of our screen, and the angle is 21 degrees in this case. So because the two angles are directed in the opposite direction, so there is anteversion at the hip joint and internal rotation at the knee joint, the two angles have to be added up in order to receive the combined femoral anteversion. To demonstrate this, we overlap the two images here. So you can see the angle at the hip joint and the angle measured at the knee joint, which then add up to a combined femoral anteversion of 46 degrees in this case. So in the next step, we want to measure the amount of tibial external rotation. Therefore, we scroll down to the most proximal aspect of the tibial plateau and draw a tangent line at the most posterior aspect of the tibial condyles. Then we measure the angle again to a reference line which is just parallel to the lower border of our screen, and we have here an angle of roughly 5 degrees. Next up, we need to measure the amount of tibial rotation at the level of the ankle. Here we have basically two options. The first option, or the first type of measurement, was described by Goutelier. You scroll down to a slice that cuts just through the most proximal aspect of the talus, such as this slice here, and then you draw a line at the articular aspect of the medial and the lateral malleolus, as you can see here. Then you draw an interconnecting line between two midpoints of these lines and measure the angle again to our reference line. So the angle is roughly 2 degrees in this case. The second option, or the second type or technique of measurement, was described by Jacob, and here we need to draw circles of best fit in the most distal aspect of the tibia and the fibular at the same slice. And again, we draw a line which connects the two centers, and we measure the angle to our reference line, which is 9 degrees in this case. So as you can see, depending on the technique of measurement, there can be some considerable variation in external tibial rotation. However, it is known that there is a high physiological variation of tibial external rotation. So again, for educational purposes, we are overlapping the two images at the level of the tibia, of the proximal tibia, and at the level of the distal tibia. And so in this case, as the two angles are rotating in the same direction, we need to subtract the two angles from each other rather than add them up. So in this case, that would be tibial external rotation of 9 degrees minus 4 degrees, so roughly 5 degrees of tibial external rotation. So in this case, the femoral anteversion clearly exceeds the physiological range, which is reported to be around 15 to 20 degrees. For tibial external rotation, the physiological range is between 20 and 30 degrees. However, there's a high range of variation of up to 40 degrees. Also keep in mind that the terms femoral anteversion and femoral internal rotation are used synonymously depending on whether deformities at the hip or at the knee joint are discussed. Well, I hope you enjoyed this concise tutorial on rotational analysis, and thanks for watching.